Welcome back to 12 on Health. Now, if you experience heel pain or other musculoskeletal pain, a local podiatrist wants you to know there's a treatment available in our area that may help alleviate your problem. We are now spotlighting an FDA-approved laser technology that uses pressure waves to stimulate blood circulation and healing. The idea to help damaged tissue regenerate. Here to help us understand the treatment is podiatrist Pedram Hendizadeh from Associated Podiatrists of Fairfield. Thanks for being here.
Thank you for having me back.
Now, this is the key piece. This hand piece is how you are able to direct the energy.
That's correct. There's a hand piece and there's a head. There's an activator here that turns it on, and basically we direct it to the area where there's inflammation. And we do about 2,000 to 2,500 sound waves. The machine is called an EPAT system, which is extracorporeal pulse activation therapy.
Okay.
So these acoustical sound waves basically regenerate blood flow to the area and transform the chronic inflammation into acute inflammation.
While you're doing this, is the patient feeling pain?
A little bit, very little, not much at all.
Because it's kind of aggravating the area for the moment?
Just slightly. There's no anesthesia, so they do feel a little bit.
Okay. We have a little bit of video as well we want to show folks just so they can see it at work. So you're, in this case, it's on the patient's leg.
Right. This is for a calf, a strained calf muscle, or tight gastrocnemius muscle. And basically the machine is able to increase circulation to the muscle to get it to heal faster. Okay. It's great for sports medicine, great for athletes.
I would think it's like a heavy-duty massage.
A little bit, but it really produces that blood flow.
It has a deeper effect?
Much deeper.
Now here's what you do with patients. Tell us what's going on and what is the key area for heel pain in particular? Heel
pain is generally just underneath the heel, usually on the inner aspect of the heel, and it's caused by plantar fasciitis. There's inflammation of the plantar fascial ligament. The plantar fascial ligament is an elastic ligament, sort of like a rubber band. It expands and contracts as you walk. When you're sitting or you're laying in bed, when you first get out of bed, you step down, you kind of get that sharp pain. That's plantar fasciitis. It's just like a rubber band. An older rubber band doesn't stretch as well. As the rubber band gets older, you get older, you gain weight, it loses that elasticity and it gets tight.
If somebody experiences that, is that something they'll be dealing with for the rest of their lives?
Generally, no. It's a temporary problem.
Okay. And can icing it help or anything else?
Yeah, plantar fasciitis is generally easily treated with icing, stretching, night splints, orthotics. Sometimes we have to get a little more invasive, a cortisone injection or physical therapy. If those treatment modalities are not effective, at that point we would consider shockwave therapy or EPAT. If that doesn't work, then we lead up to surgery.
Now you had an example you were telling me about earlier. One of your patients came in pretty bad pain.
Yeah, I had a patient, about a 45-year-old gentleman, comes up from Westchester. Photographer, is on his feet every weekend doing,
I bet,
weddings and bar mitzvahs. We tried everything for him. He has been in the practice for a couple of years. He tried orthotics, stretching, night splints, physical therapy. We even tried some anti-inflammatory medications that calm the nerve down. Nothing really was effective. He had the EPAT machine several weeks ago and he's doing fantastic.
So why don't you just go straight to the EPAT machine?
It's generally not necessary. Most patients, 90% of them get better with conservative treatment options before the EPAT.
Okay. Is there any risk to it?
There's virtually no risk, no side effects. You might get a little bit of bruising, but it's temporary. There's no anesthesia, there's no downtime. Certainly a lot less risk than surgery.
Now, what does it cost? Because I understand in many cases it's not covered by insurance?
Currently it's not covered by insurance. The initial visit is always covered by your insurance. X-rays, ultrasounds, generally covered by insurance.
Okay.
A typical treatment for having one treatment is a few $100s.
Okay.
And you need about three to four.
About $300 per treatment?
Well, if you want an exact number, we currently charge $375.
I hate to say this, but per foot?
Per site.
Yeah, per site.
So
we
discount if you're doing two locations, absolutely.
Do people tend to have plantar fasciitis in one foot, both feet?
Most people just have it on one side, but
and
some people have it on both sides.
It's just random?
It is random. We can't really figure out why someone gets it on one foot and not the other.
And what are we doing in everyday life that we should do differently to avoid heel pain?
Things you could do is certainly lack of weight, lose weight, wear shoes that have good support.
And when you say good support, you mean arch support?
Arch support, and in women actually a little bit of a heel helps. There's less pressure on that plantar fascial ligament when you're elevated.
Isn't that interesting?
So heels are okay sometimes.
And some of the popular winter boots you're not a fan of?
Like Uggs?
Yeah.
Not a big fan. They really don't give you much support.
They're cozy, but...
They're cozy, they feel good initially, but we see a lot of problems with fungus and bacteria in the Uggs, and there's really not much support. So you can strain your ankle, your knee, your hip, your low back.
I get you. You want us to find shoes that have arch support. Thank you
Right.
so much.
You're welcome.